Required items checklist: microcentrifuge tube with EDTA, normal microcentrifuge tube, syringes, pipettes, diluents, test cards, fluorescence testers, centrifuges. Key procedures and precautions. Serum plasma collection. Recommended blood collection sites: cephalic vein of the forelimb, located on the upper dorsal side of the forefoot. Tips for preventing hemolysis: select the appropriate size needle based on the dog's body size. For puppies, small dogs, use 5G to 3G fine needles. For large dogs, use 2G to OG needles. Release the tourniquet before drawing blood. Once blood return is visible in the needle hub, we can use a microcentrifuge tube or a blood collection tube to collect blood. Microcentrifuge tube, collect 1 milliliter. Blood collection tube, collect 2 milliliters. The normal tube is used to collect serum. Add whole blood to the tube without EDTA and mix thoroughly, and then place it in a centrifuge. The tube with ector is used to collect plasma. Add whole blood to the tube with EDTA and mix thoroughly, then place in centrifuge. Centrifugal speed and time: 5,000 per minute 5 minutes. If the speed is 3,000 per minute to 4,000 per minute, the centrifugal time should be 10 to 15 minutes. The sample must be clear and transparent, with no obvious turbidity, precipitate, or abnormal color. Samples should not be used if they show severe hemolysis, jaundice icterus, or a lipemic appearance, to prevent sample quality issues from interfering with the accuracy of the test results. Pipette operation notes: adjust the sample volume to 75 L by turning the knob before use. Using the plunger stops, drawing sample, press to the first gear. To exhaust before inserting into the liquid, insert into the liquid, then release slowly. To aspirate the sample, pipette insertion depth: 1/2 of the upper clear liquid depth. Expelling sample, press down to the second gear, fully pressed when discharging. Prepare the Healvet product and start testing. Once the package is opened, the test should be performed within 1 hour. Test cards stored at low temperatures need to be restored to room temperature before opening to avoid moisture absorption. Each test card can only be tested once and cannot be tested repeatedly. Turn on the instrument for testing. Turn on the device. Connect the power supply and press the switch. Take out the ID chip. Make sure the batch number of the ID chip is consistent with that of the test card, and insert the ID chip. Read ID chip. Click to read ID chip. Enter pet information. Sample selection: serum, plasma. Select standard mode. Here open the test device packaging. Turn the pipette dial to adjust the value to 75 microliter. Replace the pipette tip. Draw 75 microliter blood sample. Add sample to diluent. Gently flip 3 to 5 times to mix the mixture thoroughly and avoid violent shaking and foaming. Replace the pipette tip with a new one. Pipette 75 microliters of the mixed solution into the sample well and avoid bubbles. Warning: the sample should be added in sufficient amount, otherwise an error will be reported and the test will be invalid. Standard mode: after adding the sample, the test card should be pushed into the instrument immediately, otherwise the result will be invalid. Correct direction and position: the QR code must face inward. The test card must be pushed all the way in until it stops. Warning: if the test card is inserted upside down, the barcode faces outward, or the test device is not pushed to the bottom, an error will be reported and the test will be invalid. After clicking test, the instrument starts counting down and automatically reads the test results. After 15 minutes, the specific reading will be displayed on the instrument. Print test results. The following are 3 cases of equipment errors. The test card is not pushed to the bottom. The screen will display unable to match. The test card is inserted upside down. The barcode faces outward. The screen will display unable to match. If the sample volume is insufficient, the screen will show that the test is invalid. When you pull out the test card, you will find that the blue line has not disappeared.